fold, fold, orbit. Okay, this is for full face treatment. Okay, and mandibular line, of course, some jowl here, and then the mandibular line is here. Okay. Then, insertion point. Look at her. Okay, a nice smile, please, madam. See?
Okay.
Don't go here.
Too much movement
She
here.
will feel here better. Zygomatic arch, okay? And here the same. Here is more or less in front of the tragus, okay? Yeah. Hello?
We can do it for this needle.
No way. This is no indication. Because it's no indication. I'm sorry.
Maybe.
No.
Yes,
Then-
doctor?
Yes, please. Then, in order to improve this jowl,
يا جماعة
in order to improve this jowl, as we were talking before, you see, with threads, talking about threads, okay? In order to improve this jowl, do this is not efficient, because this is not a vector we can achieve with threads. And even with surgery we work on this vector, not this one. This is too flat, this is for the neck. So with threads, in order to deal with this jowl, which is, let's say, our major problem, we must gain back volume here and obtaining this situation, okay? This is what we are looking for in the mid-face with threads. Then we're gonna work on this from the lower part of the face, but later, in the second part of the session, before, in a patient like this, look here, okay, look on oblique view, you can see some palpebromalar groove coming here, so that means ptosis.
Yeah, it should be put upper, not lower.
Exactly.
Before and after that,
Yes.
maybe I can.
Yes. But it's a surgical topic, okay? You cannot work
But
just in
I
one
put
part.
My hands like this. Or
Yes.
I put my hands like this.
Yes.
What
but-
should I better?
No, this is the same. This is the same vector. This is the same vector. It's just moved on the face, but this is a correct one. The fact is that to achieve this vector, or this one, that's the same. Okay, we must consider that it's not just a matter of pulling the skin, because here we must consider the volume.
Okay.
Here we can pull.
لا يمكن دبرت واحد الامكانيه.
Sorry.
Okay.
And
It should be stimulation collagen here
yes, but
to
you
lift the skin.
No. Stimulation of collagen will come to improve the skin,
Okay.
not to lift or whatever. It's a general
Okay.
amelioration. What I mean is that with threads,
Okay.
you must work before here
Okay.
and then take care of here. So in which way? As I show you, you take this and you rotate it.
Okay.
She has a very thin skin,
Yeah.
so you can feel it. But with cannulas, blunt cannulas, you are always safe because you are working in the fatty tissue and you are not allowed to move. So you can be very relaxed, then no barb will engage the dermis. Even if this is a very thin skin, so very difficult skin for needles.
We can use the same nano, Aptos nano.
It's the big brother. It's Excellence Visage. It's blunt cannula.
We can use here.
20 centimeter,
Ah,
and
good.
it's the same thread. And then you do like I show you. Let's say, take these 3 points, 1, 2, and 3, okay? 1, 2, and 3. This is point A, so do A1,
Okay.
A3, A2. Okay? This loop allow us to improve the volume.
Same exact thing.
The
with
same, the same. The technique is the
previous
same. But here we have longer thread, and so I can go catching everything and coming back, and then also from here. Okay, so A1, A3, A2. Once it's done, and you need 2 threads at least, two threads means that one thread is make almost the 3 passages. Okay, this is very important because we used to think, hey, 1 thread, 1 passage. No, this thread will make almost all the 3 passages.
Okay,
So
I put 2 threads.
2 threads.
And 6 passages.
Yes, exactly.
Okay.
Then
In the
once
same
it's
area?
done, yes, the same. You say A1, A3, then you make part of A2.
Yeah.
Okay, with the other threads, you make A2, A1, A3.
Okay.
Once you did it, you skip to B point, okay? B point is point 1 and is point 2. So you have the parotidal fascia here, it's very, see, no movement at all. Then you pass, and then you make A1, A2. Sorry, you're right. B1, B2, okay? Then in this way, you pass here, then you lift tissue, and you do like this. And see what happened. See? You do like this, then you lift the tissue, and you go here.
Which
In
type
order
of,
to have
Visage?
Visage, always the same pack. Okay? 2 threads here, 2 threads here. You still have 1 from this side, then you have other 5. With that one, that's personal advice, keep it, treat the other side, and then check it. Because maybe you will have to
Asymmetry.
correct some little
so
asymmetry.
4, and then
Four.
we will check up, then we
Yes.
will decide. We have 2 extra.
Two extra, 1 per side, but could be 2 on one side, for example. Okay, maybe one side is more ptotic. It doesn't matter that you have to put 5 and 5. That's
So if you have asymmetric, what should we do?
you have
add 1.
to,
2.
yes, you have to work on the asymmetry with the 2 threads you still have. That's the rationale of this. You can use all 5 threads, but then if you have some asymmetry, you are in danger to open another pack. That's the matter. Okay. Once you have done this, from here is that, and here is like that. In which way should I work? Here, to gain volume, I must go deep in the fat space. Subcutaneous fat is thick. Here, with my cannula, I go deep. Here, superficial. If I go deep, when I put tension, the tissue will be pumped up. And I will have my bulk of volume. If I go superficial, like here in the jowl, as I put tension, the tissue will be flat. So we'll solve the jowl, and we can enhance the midface.
No danger to get pimples or something because
Here, no
the-
way, no problem.
she's thin.
But we are working in the fatty tissue. So even if you go superficial, since you
Still in the fatty tissue, but superficial.
yes,
Okay.
yes, always.
I thought in the dermis.
No, remember that you have a blunt cannula, so you are not able to grab the derma.
Okay.
Okay, these threads are the better combination between safe, well, for the patient, of course, safe for you, not easy, but safe. I mean, you can keep concentrate on what you have to do. Without thinking about, oh my God, with the needle, maybe I will get the derma and whatever. So it's a nice compensation of everything, and it is perfect to achieve the first result, full face. Fortunately, we cannot do, but this is the starting point. This is not the entry level. This is not the lowest level. You can achieve excellent result with Visage, but you have to apply the technique to improve your learning curve. Then skip to other threads which are much more demanding. I never do that threads for hair with this thin skin. It's true, she lose a bit of mandibular line, but with my skin under this thin, with my needle under this soft and thin skin, I will be full of dimples, and they won't solve in a while. So that means the patient will come to you every week, maybe twice a week. Say, hey, it's getting better, but they are still here.
So,
That is
but we are
normal.
superficial here, so we only have problem in this area.
No, with
All-
Visage, you have a blunt cannula. You cannot engage the dermis, even if you try to.
So we don't. There is no